Have you heard the term food insecurity? Food insecurity is when someone doesn't have access to enough affordable, nutritious food. People in every community in the United States experience food insecurity, including many people with CF.
You may be experiencing food insecurity if you don't have enough food or worry about having enough. You find yourself eating less food at meal times, or you eat fewer meals throughout the day to save food. If you have to buy food that is lower quality, less varied, or less desirable, or if you have few places to buy affordable, healthy food.
Food insecurity can affect anyone, both people with low income or no paid employment, and people who have steady jobs. Research shows that food insecurity exists in the CF community regardless of how much people make or their education. Many people with CF experience conditions that put them at risk for food insecurity, such as poorer health, expensive treatment and care requirements, lower income, and having a disability or a child with a disability. Food insecurity affects mental health too. It's associated with a significantly higher risk of depression, anxiety, sleep disorders, and stress. And people with CF and their caregivers are already 2 to 3 times more likely to face these mental health challenges when compared to people in the general population. It's important to understand that you are not alone. Living with CF is expensive, and food is expensive too. Here's how others with CF describe their experiences with food insecurity. It's affecting my health because the food I'm eating is more processed food. I live in an area where getting fresh, healthy food is a challenge. The water is also undrinkable, so on top of putting expensive filters throughout my house, I also buy water. If I want to get healthy, fresh food, I have to travel 2 hours. I have been on SNAP since 1991. I know there is shame and stigma associated with saying that, but I've moved past my embarrassment to advocate. If you find yourself experiencing any of the following, it's time to look for help. Difficulty accessing the foods recommended by your doctor or dietitian. Having to choose between paying for food or other basic needs, such as your car payment, rent, utilities. Going without food so your children can eat. Or taking less medication than you should so you can afford food.
Help may be available. It's important to understand that every state and county is different in terms of available resources. While some programs are free, eligibility and benefits can vary from state to state and program to program. To start, find out if you're eligible for local food pantries, community or hospital-based programs, medically tailored meals, which are typically home-delivered, planned out by a registered dietitian, and require a referral from a medical professional or health insurance plan. State or federal programs, such as the Supplemental Nutrition Assistance Program, also called SNAP, the Special Supplemental Nutrition Program for Women, Infants, and Children, known as WIC, or school lunch programs, or food or similar benefits through your health insurance plan.
You can talk to your care team or call CF Foundation Compass if you're unsure how to learn more about these possible resources or need help checking your eligibility. If you're eligible, these programs can provide support for accessing food. Some CF care centers have unique ways of trying to help. For example, one CF care team member described her efforts to help her patients access food this way. I have recommended produce and meal delivery services that attempt to eliminate food waste, as well as farmers markets and community-supported agriculture, or CSA programs, to access healthy, fresh foods. Our clinic also uses some funding to provide grocery gift cards to patients to address urgent food access situations. Another said, our CF dietitian has been able to support families in accessing vouchers to cover the cost for nutritional shakes that are vital to some of our pediatric patients' overall health and weight gain. And remember, we're here for you too. You can contact us at the Cystic Fibrosis Foundation, where Compass case managers like me are here to help every step of the way.